Does eating red meat increase your risk of developing type 2 diabetes? I'm Diana, your diabetes dietitian. According to a new study led by researchers from Harvard School of Public Health, it may. The researchers found that the consumption of red meat, including processed and unprocessed, was strongly associated with an increased risk of type 2 diabetes. And this increased risk was seen with just 2 servings of meat per week compared to those people who ate fewer servings. And they found that the more servings of meat people ate a week, the higher their risk was. They also estimated the potential effects of swapping a serving of meat for a different type of protein source. And they found that substituting 1 serving of red meat with legumes or nuts was associated with a 30% decreased risk of type 2 diabetes. Now, this isn't entirely new research. It just adds to the total body of evidence that red meat, especially processed meats, is associated with an increased risk of type 2 diabetes. So if you're looking to decrease your risk of developing type 2 diabetes, or if you already have type 2 diabetes and you want to place it into remission, one simple nutrition hack you can try is replacing some of your meat intake with a plant-based protein like beans. Beans are versatile, cheap, and packed with lots of nutrients.